Hi guys, how are you? This is Ali from Medicine Made Easy. Thank you for checking my YouTube. Today we will talk about surgical suture materials. This is an important subject in surgery and also in other medical specialties. For example, you need to suture a simple cut in the emergency room, or for example, closing a whole abdominal wall in the operating room. You need to know what characteristics that make you use this suture material and not the other one. And are there more than one suture material available for this purpose or that purpose? You need to know that. So we will go over those materials and the characteristics of the suture materials in this PowerPoint slides. First of all, we will need to know, is that suture material natural or synthetic? Actually, this is not a very important thing to know, but in case somebody asks you, at least you have an answer for that. For example, silk. Silk is a natural synthetic material. It comes from the larva of the cocoon, from the worm. And plain gut, for example, also a natural kind of a suture material. And it comes from the bowel of the sheep. I know they call it catgut, but it doesn't come from the cat, it comes from the sheep. And we have also examples of synthetic suture materials. For example, nylon is a synthetic suture material, and polypropylene or proline is also a synthetic kind of suture material. Is the suture material absorbable or non-absorbable? This is a very important thing to know, because you cannot use, for example, a non-absorbable suture material inside the abdominal cavity, for example, unless you want it like to stay forever for a reason. Or, for example, you cannot use an absorbable suture material for a place you want the suture to stay. I'll give you an example, maybe easier one. For example, the outer layer of the abdomen of the bowel, the outer layer of the bowel, which is the serosa, it is preferable to use a non-absorbable suture like silk, because it is the strongest part of the bowel wall. But in order to suture the mucosa of the bowel, we need an absorbable kind of suture. Yeah, this is a good example, I think. There are other more examples. Let's see about the examples here we have. Plain gut is an absorbable one, and it completely absorbed in 10 to 14 days. While chromic catgut, chromic is kind of a dyed kind of a cut, a dyed one, and they add some material to it, so it make it absorbed in a longer time than plain gut. And for example, where we use the chromic catgut, I see them using it in, for example, dental procedures or something inside the mouth, because we don't want it to stay for a long time. We want it to be absorbed and no need to be removed. Also, for example, they use it sometimes in the subcutaneous tissue, just to approximate the subcutaneous tissue before they suture the skin. For example, in cesarean section. So they don't want it to stay for a longer time. They just want it to approximate the subcutaneous tissue so the skin will heal without tension. Vicryl, for example, is absorbed completely in 60 to 70 days. And as you know, Vicryl can be used, for example, to suture um, the suture some of the layers of the abdominal wall too, in cesarean section and in X-lap. Monocrol, which is a monofilament type of vicryl. This is absorbed completely in 90 to 110 days, especially if it is dyed. There is dyed and undyed. The dyed one take longer to be absorbed. And monocrol also is a very important kind of suture material, very commonly used in the OR. And you notice, guys, that sometimes they use it to close the skin by subcuticular kind of sutures. So it stays for a long time. The skin will heal completely, and then it will be absorbed. And it's a monofilament, so there will be less chance of infection. So they use monocrol a lot in suturing the skin as a subcuticular kind of suture, and they will not need to remove it later because it's absorbed, but take long time to absorb, which is okay because it's a monofilament. And we will come to those characteristics later. Silk, nylon, and prolene are considered non-absorbable. So, as we said before, silk has been used a lot in the past. Now the use of silk is less, but they still be used, for example, to suture the skin by simple interrupted sutures, and also they use it to suture the serosa of the bowel in X-lap when they do end-to-end anastomosis. Nylon, for example, and prolene are monofilament kind of sutures. They are non-absorbable. They are used, for example, to suture the nerves together or to suture the tendons. Okay? And also to suture the fascia. Yeah, this is an important thing to know too. Monofilament or multifilament. Catgut, for example, catgut, prolene, and nylon are considered monofilament. They are single-stranded. That's how the monofilament is. Single-stranded, easier to pass through the tissue. But easier to pass through the tissue, as we said, they are kind of hard to handle with the hand. So because they have a kind of memory, more memory than the multi-filament. So they need kind of more knots to have a secured knot. And the other good thing about them, they are more resistant to microorganisms. On the other side, silk, vicryl, and fiber wire or ethibond are considered multi-filament. They are multiple-stranded, has a greater tensile strength. They are stronger than the monofilament, and they are easier to handle. Okay, we don't need to make a lot of knots, but there is a more risk of infection because they are multi-stranded, so they can harbor more microorganisms. Yes, we have some extra notes to go through. Maybe they're interesting. We will see. Fiber wire is the strongest suture material, followed by the PDS, polydiaxanone. Nylon and prolene has the highest memory, and we need to make about 6 knots to get a secured one. Skin suture material. Skin suture material removal. So if we need to remove the skin sutures, if we use, let's say, a non-absorbable thing to suture the skin, and we need to remove it later, how long we have to wait to remove the suture? This depends on the body parts. For example, in the head and neck, we can remove them in 3 to 5 days. Why? Because due to high blood supply. But in the foot, we need to leave them for 2 weeks because of less blood supply. And that's how it is. Healing depends on blood supply. The size of the suture materials we have, definitely you hear about 0, 20, 30. So whatever the number that comes after with the 0, like for example 20 is larger than 30. So when the number that comes before the 0, when it is higher number, means like a small kind of suture material. So the smallest one is 10-0, and the largest one is number 5, because after 0 comes 1, and then 2, 3, 4, and 5. And then smaller than 0 is what? 20. There is no 10 because 10 is 0. So smaller than 0 is 20, and then 30, 40, 50, up to down to 10 zeros. So 10-0, for example, is a very tiny suture material used, for example, in eye surgeries, or for example, in microsurgery for anastomosis of like nerves and very small blood vessels. And for example, number 5 is very big kind of suture. It might be used for like anchoring tendons, for example. Personal preference and how much the suture material cost also play a part in choosing the sutures by the surgeons. Let's go over some generic and brand names of sutures. I think it's kind of interesting to know what the generic name of the suture. We always hear about the brand names in the OR. For example, polyamide is nylon, polypropylene is proline, polyglycolic acid is Dexan, polyglactin is Vicryl, polyester is Ethibond, polyglycopron is Monocryl, polydioxanone is PDS. I hope I didn't forget anything. Definitely I didn't go over everything about sutures. I will leave something for you. And also, there is another suture material. It's kind of suture, but not a suture. Definitely you hear about it, which is a stainless steel. I didn't mention it in my PowerPoint slide, but I want to talk about it a little bit. Stainless steel is very kind of hard to handle a suture material, and there is a special way to handle it, a special way to put it in the tissue, and actually it's used to approximate the sternum after open heart surgery. Okay, so it's a cardiovascular kind of suture material, usually handled by a special kind of instruments. The needle holder that used to handle the stainless steel suture, called sternal needle holder, is a special kind of needle holder, and it's used, as we said, to approximate the sternum in open heart surgery. Thank you guys for listening to my YouTube. I hope the subject was not boring. If you have any question, if you have any comment, if there is any mistake in the PowerPoint slides, please let me know. Thank you for your support. Please subscribe, like, and share. Thanks a lot. Again, this is Ali from Medicine Made Easy. Good luck in your career and your education. Bye now.